It's not me. Roll call shows everybody's here except Bart. He is excused. You have an agenda in front of you. I would look for an approval of that agenda.
So move.
Okay, moved by Kirschner. Second by Johnson. Is there any additions or corrections? Otherwise, all in favor?
Aye.
Opposed? All right, that passes. Approval of the minutes of the 12/2/2025 regular meeting. Is there any additions or corrections to those minutes? If not, I would look for a motion to approve.
Make the motion.
Okay, motion by Jay, second by Mark Piaski. All in favor?
Aye.
Opposed? All right, that passes. Public comments on the agenda items or public comments. We have one who would like to speak to us.
Good afternoon, everyone. For those that don't know me, I'm Dennis, or my friends call me Denny. So I hope you all call me Denny. Denny Plants. I guess starting out, I grew up about 2 blocks from here, within walking distance. John and I are classmates, the board supervisor. And I will tell you, after a lot of deliberation, a lot of waking up at 3 a.m. in the morning and staying awake, I have decided to run for your sheriff. I had looked at the candidates or the possible candidates running and really couldn't see any of them having the knowledge and experience to run the sheriff's department that I have. I've been an officer for now going on 40 plus years, 20 plus as a chief of police, 14 as a state trooper. And I look at it, I love what I do. I love the people that I work with. And with that being said, I'm going to put together my resume. And for anybody that wants a copy of it, it will be there for you. Certainly for the county board members and anybody that would like, I will take time out of my schedule to sit down with you, go over any questions, comments, where you think the sheriff's department should be heading. I've always looked at myself, whether it's EMS, emergency management, everybody and anybody. You don't get to be a chief of police for 20 years if you don't know how to work with people. And that's what it's about. So from here on in, if anybody has any questions or would like to get a hold of me, I'm pretty easy to find. So from there, I guess I just wanted to make it official, let you know I'll be coming to the county board meeting. And hopefully by then I'll have those resume items for you and, you know, let the people decide, go from there. So I don't think anybody asks any questions or anything like that.
I'm not going to ask a question.
Oh, okay.
You were a state trooper, you said?
I was a state trooper. I joined the state patrol back in 1985.
I thought I might have met you a couple times. We'll leave it at that.
Go fast as possible. So, but with that, I think my resume is going to speak for itself. I think I was pretty successful. I love being a state trooper. I'd gotten the opportunity to take over as chief of police over in the city of Chilton. I was the chief over there for 5 years. And at that time in our life, we've always called this home. And the opportunity when Chief Jim Dobson over in Berlin retired, I had the opportunity to go over and take over the reins in Berlin. Most of you know Doug Christensen from the Sheriff's Department. Doug and I worked together. He was primarily my school liaison for all those years. So with, if you got any questions, you can ask Doug. You know, so with that being said, we moved to Berlin. I was the chief there for 16 years. And then right now, only because Wally was a little late, I work for Joe down in Marquette County at the Sheriff's Department there. So that's also given me a much more rounder look at law enforcement. So I've been with the state, the county, the city, and you get to see the dynamics of both of those and how those work. And how a county board works as compared to a city council, and also compared to what happens at the state level as well. So I know I've dealt with Ruth before and Megan, and you have a wonderful group, you have a wonderful staff. I guess I'm looking to just hopefully be part of that. So, all right, thank you.
Is there any other public comments today? Okay, seeing none, we'll move on then to fire services report.
It's been a busy fire
Busy.
season so far, so.
Okay, did you want to give any report on that, Alan, or?
Yeah, I can just say that we've had several structure fires in the past 2 weeks, mostly due to heating, wood burners, heaters and such. So, but yeah, otherwise that's all. Yeah, it's been real busy.
Okay. Very good. All right, then we'll move on to medical examiner's report. Yes.
Good evening, or it's still afternoon, isn't it? Sorry, time flies when you're having fun, right? It's still cold outside, just to let everybody know that. And I still have a cold, so please bear with me in my coughing. It has been a very busy beginning of the year and end of the year for us. In 2025, December 2025, Washera County had 23 total deaths, 22 of those were ME cases, 19 natural, 1 accident, 2 pending toxicology and 1 autopsy. Marquette County had 11, and all of those were deemed medical examiner cases. 10 of those were natural, 1 suicide, no autopsies. In January of 2026, so just this last month, we had 23 total deaths from Washera County. 21 were ME cases, 17 natural, 4 pending, 1 autopsy. Marquette County had 18 deaths. 16 of those were ME cases, 14 natural, 1 accident, and no autopsies. I wanted to kind of share with you too that excuse me, antibiotics still hasn't cleared it up. That when we talk about the amount of cases that we have, and then the ones that we actually deem as medical examiner cases, that is because we're taking jurisdiction over them. We don't take jurisdiction over all cases that are reported to us. If there is someone who's on hospice care, there's no injury, and they are under a physician's care, they're not being cremated, there's no reason for us to get involved. So we don't take jurisdiction over that case. The state statute that we are provided jurisdiction under is 979, and it just gives us those basic guidelines onto how we serve our death investigations and what cases we are to be looking into. So I wanted to kind of separate that out when I tell you the amount of total cases and then the ones that were deemed ME cases. There's a difference there, and I just wanted to really elaborate a little bit today. Does anybody have any questions on that? No? Okay. I do have a year-to-date budget report for you, and I have it printed off if you would like that. Can I approach? I know it's not court, but can I approach? Even ask the judge, I just want. All right. All right, so I forgot my little readers, but I'm gonna do the best I can here. So if you look at the revenue in the first portion of that budget, you will see that cremation permits and death certificates are actually at a negative and then we're over. And that's because of the combination with Marquette County. So we see that, and then we see where it says reimbursement for services on that same bottom portion. And that's where we're getting paid for any reimbursement of mileage, any autopsies, any pathology, any type of toxicology that we do, that gets reimbursed to us through that line item as well. So when you look down and you see pathology is over as well as travel, you'll note because it's being reimbursed in that revenue portion. But all in all, we are under budget, which is good. Do you have any questions on that? No. Okay, I wanted to kind of revert back to our amount of deaths that we've had and just bring attention. I know that Stephanie from Public Health was at one of these meetings recently in regards to our suicide rate. We did have 8 total suicides last year just for Washera County. The year prior to that, it was, I believe, 4 or 5. We've already started off this year with 2. So we are trying to figure out a way to bring awareness to mental health and trying to get some flyers out there, some information out there. We're trying to look at grief support for people because we do know that when this happens, the children of those individuals have a 50% increased rate of committing suicide themselves within the first 5 years after their parents die. So we want to really reduce that as much as we possibly can for our county, as well as Marquette. Marquette actually had one that I'm aware of in 2024. In 2025, they had 4. So they are also increased tenfold. So I just wanted to bring that awareness to you because I wasn't originally going to do it, but now since we are starting the year off with already 2 suicides, I really need you guys to be aware of what's happening. Okay, we still have 2 positions available for the office, the deputy ME on call and then the deputy ME, the 30 over that's in the office right now. We've been getting applicants in, but we're looking at exploring the opportunity of advertising in the local papers to kind of draw some more opportunity there. Anybody have any questions? Otherwise,
Any questions for me? No? Okay, very good, thank you. And there is no unfinished business or new business. So we'll move into the EMS report.
Okay, so like Amanda said, we've been busy, critical level of calls, with where we're sitting at. But we did not bring a finalized budget with us. It takes a little bit, our payments to come through and that kind of stuff. So we're waiting, typically we don't know where we're sitting at until end of February, March, for our final numbers with EMS. So as soon as we have those, we'll present those to the Public Safety Board.
We're getting a lot of that with these people reporting things don't catch up for a while, and we've seen that too before. So
yeah, and then the government shutdown, there was no payments that were going out from that, and they're making payments in December and January to back pay us for stuff that wasn't paid for and was on. So we wanted to be able to give you clear cut numbers. We also had a meeting with Megan and Sarah about how the EMS budget looks for you guys. I know I've had that conversation with a lot of you at, what is your actual revenue? Like what did you bring in? So we talked about simplifying that in the 2027 budget. So that's one number on our line item, and we don't have to add, subtract, or, have you guys do some calculus, to be able to figure out how much EMS brought in. So I'm looking forward to making that change for 2027. We have 2 open positions. But we did just have a hiring process in January, and we were able to bring on 5 part-timers who all live in the county. They were people that went through our EMR. Then they went on for the EMR to EMT, and now are moving into part-time positions with the county on the ambulance. So I'm really excited about that. We also were able to fill the 2 full-time positions with EMTs that were attracted to the position because of our paramedic program that starts in August. So we're going to continue with that partnership with Fox Valley Technical College, and our next paramedic program will start in August. Right now, I believe we have 4 or 5 that'll be starting that program. Their accreditation, they have to go through educational accreditation in order to be able to teach paramedic programs. This is their year to do their accreditation. So the KHAP people will be coming out to Washera, taking a look at our training room, our equipment, those types of things. And then I'll have to go up to Fox Valley to kind of meet with them and answer questions about how we teach the paramedic program so that they can stay accredited. Just part of the partnership, that we have with them. We did have our annual ambulance inspections. We found out that our new state inspector from Madison actually lives here in Plainfield. She's retired from the state police. We've seen her on several scenes. It was kind of interesting when she walked in to know who was coming. But Steve worked very diligently to get those ambulances, and all 6 of our ambulances passed inspection. We had nothing that we really had to fix. So I was pretty excited. I know the last inspection that we had with multiple ambulances, we did have 1 fail because of brakes. But this time, using combination between Renners and the highway, we've been able to keep those up. One of the interesting things that she did ask for, though, was a signed letter from our mechanic that they do.
They're certified to do a DOT inspection.
Right, and right now, highway is not certified to do the DOT inspections on our ambulances, so, we do have to use, on our major repairs and that kind of stuff, outside of oil changes. Somebody that is DOT certified to work on the ambulance.
At least once a year.
So that's been working really well. Outside of that, that's all we have.
Okay, sounds good. Does anybody have any questions? Okay, very good. Thank you. Okay,
We move into the EM report then.
Like I said, in the fire side of it, it's been busy, structure fires and accidents and various snowstorms. Throughout the past couple months have been keeping me out of the office, but for committees, the school safety committee, we're still continuing our next active shooter drill in Tri-County in August 2026. Our state EMPG plan of work group, we meet monthly. The fiscal year 2025 EMPG funding was accepted, but Wisconsin hasn't received the funds. And then after the application was submitted, FEMA put an administrative hold on it for most, but not all the states, but Wisconsin is one of them. There's also some new grant conditions. So now the Department of Military Affairs sent their legal team on it. So it's going to be in the legal process probably for the next several months until they release the EMPG money. The state EPRA work group, that group is really focusing on keeping that grant alive. The state funded, not federal funded, so they're able to find money and support that program as it stands today. The grant management, Wisconsin County will eventually receive the EMPG money, just not sure when. And then the fiscal year 26, which now we typically would have applied for in October 25. It hasn't even opened up yet, so we're not sure when that money, if that money becomes available. Plan updates, the fiscal year 25 EPRA was closed out as of January 31. The integrated preparedness plan was submitted, uploaded. That has not been accepted because the EMPG hasn't closed. The hazardous material strategic plan was uploaded and accepted through EPRA. And my emergency response plan was uploaded, but cannot be accepted until the EMPG grant actually closes. Some future training. In April, I have an MCI, multiple casualty incident for the responders, came out April 7th. And I'll be right here at the government center, be all day 8 to 4:30 in the 2 rooms next door. And then a general update, I guess, with all the uncertainties with EMPG, the states and counties to really focus on our EPRA and try to keep that grant alive. That's the state funded one because they're not sure when the EMPG is going to open back up. If it opens up, as we all know, the federal government is doing their thing. So they're trying to take the federal money that we're giving to the states and let the states deal with these disasters themselves. In that process, they say we're going to cut federal taxes, which they are, but then your state taxes are going to go up. Try to replace that money, and then hopefully your governor will appropriate that money to our EMs like they have in the past. So a lot up in the air right now, just a lot of unknowns with the federal government, and now they're going back through this shutdown again. So I don't know what effect that'll have. But,
Alan, so the one was for the year 2025. You know the amount on that, and you've been awarded that. You just haven't gotten the money. I mean, you've been accepted for that, but you just haven't gotten the money. Is that what I'm hearing? Or do you not know the amount, or you're not sure on the amount?
Yeah, we were given a number. If that number holds true,
okay,
then we'll have an idea. Now it's back in the legal process again. So, as you know how the legal system works, can be a mess.
It's an attorney.
So it's going to be tied up in there dynamic for some time. They've told us for the future to look for at least a 10% cut in the EMPG money. Now they're looking at maybe 30% cut in the EMPG money, if at all, if you're going to get it at all. So a lot up in the air, a lot of unknowns. On the back side of my report, you'll see the budget summary for 2025. I guess the bottom line is it shows that I'm over $9,851.18, but there's still $46,581 of grant money we're still anticipating to get. So overall,
I'm not over budget, it'll actually be giving money back to the general fund, but until that grant money comes in, that's where the final number for emergency management stands today.
Okay. Does anybody have any questions?
Okay.
We have no unfinished business. We do have some new business. It's a resolution intention to join the statewide public safety interoperable communication system for Waushara County.
Yes, this is a resolution to actually be eligible for a grant, for a radio grant. In order to be eligible, we have to have a resolution saying that we agree to adopt and join the new Wisconsin system when it becomes available. That's that 800 system. When it becomes available in Waushara County, and that any radio moving forward, we will have that in mind and move forward with a dual band. So that's a resolution here, just asking to have the county's commitment that we will do that moving forward.
Okay. Now, we had just discussed that. I mean, we're thinking of looking towards a dual band. But I mean, that's not 100% yet. So, is this something that has to be approved at this meeting?
It necessarily wouldn't have to. It's just if round 2 of this grant becomes available, we would not be eligible to apply for it if we don't pass the resolution. That would be the only thing, but there's nothing saying we have to.
I guess what's the feeling? Do you think we should? I mean, I do think we're moving towards a dual band.
I think that this committee should send it to county board for approval, just because we're saying that we are committed to that. If we don't have the budget for it, or the county doesn't do it, there's no penalty to not doing it, right? It says, this is our intention, we're planning on doing that, so that allows us to apply for the grant. If at some point in time we can't follow through, it just means the grant probably denied, but this is giving us the ability to apply for the grant. So I would be moving forward.
Okay, all right, sounds good. Would anyone like to make a motion to put this resolution? Okay, second by Johnson. Any other discussion? Okay, hearing none, all in favor? Opposed? Okay, so that resolution passes. Okay, then we'll move up on to the sheriff's report. And with this too, Wally or one of you guys, if you want to update us on the findings of the 911 committee to our mission.
Our ADP for January was 76. That's our average daily population for the jail. We currently, as of today, have 88 inmates in our system. 5 are transfers out of the facility, and 7 are on electronic monitoring. I put together some numbers for everybody. There's basically 5 areas that we can control for increasing our revenue. And at a previous public safety meeting, I had said that we're working on increasing revenues. So from 2024 to 2025, one of the areas is for pay for stay. So that would be when somebody is sentenced to a jail sentence and sit, they pay $15 a day to stay in jail. That amount actually decreased from 2024 to 2025 by $4,724. We only collected $22,661 in 2025. Now that varies based on if somebody ends up paying or not. If they don't pay, we do send that to the state to try to recoup money from that individual. Another area is our Board of Prisoner Revenue. That will be our sanctions through probation and parole. That would be our own people in Waushara County, and we also do accept other individuals from other counties. Say, we do get a lot of them from Brown County, just because the Brown County Jail is overpopulated. So I'll get communication from probation and parole agent in Brown County saying, hey, do you guys have room for one of our people for a 30-day or 45-day sanction? And we get monies for keeping that individual. 2025, we collected $107,340, which is an increase of $22,218 from 2024. The other area is our communication revenue, which would be our phone and tablet. Inmates in our facility, they pay to use, either watch videos, have video visits with family or friends, and talk on the phone. Last year, that was $35,098, an increase of $3,469 over 2024. Another area is our Huber GPS program that we significantly increased last year. And we increased the fees as well. 2025 was $77,255, which is an increase of $49,266 over 2024. And then the last main area that we have control over is our commissary. We did start selling nicotine in the jail as a revenue generator. And we took a look at some of the items that we were selling the most of, and we increased the prices of those by like a nickel. So 2025, our commissary revenue was $116,927, which was an increase of $27,994 over 2024. So overall, we generated an extra $98,223 of revenue from 2024 to 2025.
The expenses for that as well, like, I'm sure like the stuff you sell in your commissary, you have to buy, or is that just profit?
That's our profit.
That's your profit. Oh, that's good. Yeah.
We did get, I'm sure, Sheriff Zilke said, or reported that we had received 5 state safekeepers middle of December. We received another 4 last week, and we're anticipating receiving more as soon as they can get them scheduled. So I do expect our expenses to increase about 25% over what we have budgeted. However, the revenue from the safekeepers that we're taking in will offset those additional expenses that we're going to have. A lot of fixed expenses, water and stuff like that, is all that stuff's going to increase. So okay. We do have one lawsuit for the jail. I got a call from the US Marshal. We will be getting served tomorrow, so I'll forward that once we get that. And then we have another one that they have started through the court system, the legal process. So,
all right, very good. Does anybody have any questions?
No.
Okay.
Dispatch, we are currently dispatch short. We have one that will be off of training as of February 15th. We have one that should be off training, that their training has been extended through February 15th. To try and get her trained well enough that she would be able to be on her own. With HR on that. Still don't know if she is going to make that, but we'll definitely be one further ahead by December 15th.
Ryan, can you?
Sorry. Yes. So we will be 2 short as of February 15th, and potentially 1, but we need more towards 2. Realistically, we did do interviews last week. And of 7 interviews, we had 2 no-shows, and we are going to move forward with 3 of them. Currently in the background, working on the background of the first one. Once that one gets done, work on the second one. As we are expecting one of our current dispatchers to also head to the road at the end of March to take a deputy position. We're making progress. Not where I'd like to be, but we are making progress and moving forward with that. I sent out my maps and my statistics for last month. Again, I always like to reiterate this because it is a good thing. The national standard for answering 911 calls is having 90% of your calls answered within 15 seconds. And not only 911 calls, but including all of our admin calls to go with that. We are answering 98.76% of our calls within 10 seconds, and then 99.61% within 15 seconds. And we have had patrol staff assisting in dispatch over the last month. So even with people that are not dispatching on a consistent basis, we are well ahead of the standard, which is good. Just at a quick glance, we took about 45,000 phone calls last year in the dispatch center, and that's kind of where we sit. I'm talking now. I might as well update on the findings of the 911 committee, and if Alan and anything to add, they can. We've met a couple times, and the process I think is going well. We've reviewed some calls, adjusted some of the ways we are doing things, and going forward from there, I think the committee is moving forward. We've decided to, as the resolution later in the meeting, moving forward with the reorganization. Alan and I have also worked on looking into a policy manual, the same way that we have the jail and the sheriff's department, in organizing the policies and everything for that. And also looking for a more standardized approach for our police dispatch, kind of along the same lines that we do our medical dispatch. We don't have any hard numbers on that yet, but we have met with them and are working on getting a better demo. We just talked about the program, get a demo of that and get some numbers and see what that would cost us, and see if that can help improve our training and our responses in the dispatch center also.
Sounds good. And that it sounds like you're looking at that committee to extend into when EM takes over. So
No, I think that's a good idea. Honestly, I think that's just advisory. Is just so.
I don't think the intention was ever for that to go away once a reorganization took place. I think that's something that will continue for who knows how long.
I agree. I don't think it was intended to have necessarily a sunset date.
No.
And the intention of the committee is having a seat at the table for all of the respective parties that utilize dispatch, and that's been a huge gain, I think, from having the committee. Just a couple meetings we have had, is having a area for individuals to voice potential change and concerns and have discussion, and also be a liaison for their, we have a liaison for fire, for EMS, for police chiefs, so that they can disseminate information to their groups as well. So I don't envision that committee would disband.
Sure. Well, and especially too, I mean, you've spoken about a possibility in the future of regionalizing it. It'd be nice to have our ducks in a row before any of those talks ever start. Okay. Sounds good. Okay, thank you. Anybody else have any questions for Ryan? All right, thanks. Dan.
So in December, we had 3 false alarms for the phone panic buttons that were pushed. In January, it was only 1, so hopefully we're heading in the right direction, that people pay attention, but they do with their phones. So skeptical, hopefully it's going in the right direction. December, we had an average of 400 people come through the doors on a daily basis. January was 416.
In December, we had 17 out-of-county transports. That's coming to court, just picking up a warrant or whatnot. And in January, we had 13. So I think Marty moving into the transport thing has been a pretty good thing. He's able to come in the morning to see if something came in overnight or, you know, kind of plan that way. So I think that's headed in the right direction. And then I had reported last time that we were here that the lockdown alarms system had a few false alarms that were happening because of a misdial. We have now tweaked that more, and I don't say it's impossible because anything's possible, but it would be very, very highly unlikely that we will get one again. So hopefully people didn't get used to that happening and take it serious when it happens. So that's all I have.
Okay, any questions for Dan? Okay, Stacy.
So update for patrol, we have 2 state grants that I'm awaiting for the state's approval on. One would be a seatbelt grant for $12,000. The other is a speed grant for $10,000. They have the application. I'm just waiting for them to say, yes, go forth, get people out there. We were offered an OWI grant as well. However, with the staffing and having 2 other grants, I decided to let another agency utilize that money. Because the way I had written these first 2 grants, it's 6 deployments per week. So if there's another place that can utilize the money, I said, we're still targeted and there's a very chance that we would be up for that OWI grant again in 2027, along with the speed and the seatbelt grants again. Unfortunately, I can't put these up for deployment until the state says you have. So kind of been. I currently have 2 people that are going through all the pre-testing for Law Enforcement Academy. That academy would start March 30th and run through August 7th. So hopefully everything goes well and they get into there. The pre-testing that they have to do for the academy, aside from the paperwork, it also includes a physical readiness test. So they have to do a distance run within so much time, so many push-ups, so many sit-ups. We're kind of going back to the old physical test again. And then upon the end of the academy, once they go through that, they have to show improvement. And there's age brackets and it has to be a certain percentage improvement. I have a 3rd person potentially for a seat in the following academy through Fox Valley, which would start June 3rd and run through August 9th. So speaking with Dana at Fox Valley, she had said we would more than likely have a guaranteed seat for that particular academy class. We currently have 1 opening, soon to be 2 in our detective bureau. So that will domino effect down eventually into 2 more openings on the road. The chief deputy and I will be speaking with 1 person tomorrow who has submitted an application. Applications are kind of trickling in. So we're reviewing those as they come through. As far as training, we've got a traffic incident management training coming up in March, and that's actually going to be local at Heartland Farms in Coloma. I've got a couple people signed up to attend that need to attend yet from our newer staff. Deputy Clark and Deputy Wilson held an ALICE training at the Christ Lutheran School on 49 and A. So it's always good to continually, even with the smaller schools and whatnot, get out there in case we have some sort of an incident. So everybody's on the same page and how they should be responding to that within the school and the staff. Other than that, I just want to remind everybody, February 12th from 4 to 5 will be K9 Storm and K9 Thor's retirement gathering here in the atrium. That's all I have. Are there any questions?
Okay, thank you.
Thank you.
Scott, do you have anything for detectives?
Yeah, Detective Bureau, very busy. We currently have, as Lieutenant Vaccaro said, we'll end up with 2 vacancies. We have an individual retiring this Thursday, actually tomorrow. And Detective Galarno will be retiring, but we did fill a position with one of our road staff, Deputy Wenzel. He's 27 years experience. He's moved into the Detective Bureau. So we're up to 3 there, still down 2. Like I said, they're very busy, doing what they can to get through until we get some more help. But at this point, we're really not able to pull anybody else from our road staff. Our road staff is pretty much at minimums. And last year we were actually somewhat below minimums when we had a lot of issues that were going on with some people leaving. And when we had the shooting, that we had an individual on admin leave for 3 months until the investigation was cleared there. So he is back on duty as well. That's been cleared. He's been working for maybe 3-4 weeks now and doing just fine. In the Bureau, just a couple numbers. January had 2 burglaries, 17 thefts, 3 sexual assaults, 4 child abuse cases, 2 ICAC cases. ICAC is Internet Crimes Against Children, and 11 fraud cases. So a lot of stuff happening in just January, the dead of winter, that they're working on. So from an office standpoint, I guess kind of a big thing that's finally coming to fruition here is flock cameras. If you're familiar with flock, I know it's been discussed before, but I was able to, with Megan's blessing, negotiate a few extra cameras for the same cost that we had originally been quoted. We're going to end up with eight readers at different locations throughout the county and 1 live feed at a high traffic location in the county. We will be on board with them. Onboarding is starting right now and should be on board with them roughly Monday or Tuesday of next week, where we can use the system. And that'll allow us to tie into City of Watoma currently has flock cameras, or Granite has flock cameras, and every flock camera in the state of Wisconsin. So if we have a suspected burglar, we have a wanted person, we have somebody that's missing, we can enter that license plate in that camera. It'll tell us where they're traveling when they enter our county. Pretty much we'll have a good perimeter set up in our county so we know who's coming and going. It really helped with crime prevention. So our actual cameras are going to be installed when frost kind of lets out, that we're projecting April. So that's when our cameras, you'll start seeing cameras will go in. Then again, we'll have access to statewide plus everything in our county. Other than that, yeah, things are going well. We, like Stacy said, we have a possible interview tomorrow, and then we have 1 more opening that we would have then from a department standpoint on from deputies. So
Any questions?
Thank you. Okay, well,
Moving right along. The only thing that I have to add is we have drug take back coming up in Plainfield, April 25th at the Plainfield Community Center. And we're gonna do the National Night Out again in August. I think that went over well, and it's well received, and we'll get a committee put back together. And
I have an email out to the committee members from last year that we're going to meet, projecting to be, I don't have, it'll be the first week in August again, similar to when we did last year. But yeah, we want to collaborate with EMS and everybody else and put a nice event out. But
Yeah, that was nice. That worked out really well. Good.
yep, any questions for Wally? Okay, sounds good. We have no unfinished business, new business. The resolution authorizing reorganization of the 911 Communication Center and amending position classifications within emergency management and communications center.
Yeah, I'll take this. So the county board had directed me to review the reporting structure of 911 Communication Center, as well as the physical location of it. I've had several conversations with a work group put together, as well as presented this to the 911 board and had good discussions there and with all parties. So the recommendation before you is moving the 911 communications center, moving it on the organizational chart, from sheriff's department to underneath emergency management. And also as part of the reorganization, adding in a CTO or certified training officer pay, for officers that have that certification and do the training. We were tasked with evaluating physically moving the center from the sheriff's department to the government center. Well, we have not gotten hard figures on that at this time. I don't think that it is wise to move forward with looking into that. There are also some potential conversations to be had later on with surrounding counties about potential regionalization. And so without putting the cart before the horse, I don't think it's wise to talk about physically moving it and putting expense into that if there are going to be future opportunities for that. So I think that that conversation of a physical relocation needs to be paused at the moment, and focus on the reporting structure.
How we handle this budget wise?
So the costs associated with the reorganization that I have proposed in the resolution will essentially be absorbed into the current 911 communications budget, with some position changes that we've had or are anticipating in the near future. So there won't be an additional need this year for funding to come in. The numbers I've put together show the cost of training a new dispatcher is around 17 grand. So the hope is that this reorganization is going to provide some potential movement for dispatchers in the future, and provide better training opportunities and retention to hopefully cut down on some of that constant training. Obviously, there'll always be some, but it's been hit pretty hard with that recently. And so as far as the 2026 budget, it will be able to sustain those changes. And the long-term goal obviously is to focus on that retention, training, and have some of that budgetary saving based on
the amount we're putting into training dispatchers at the moment.
Okay. Yeah, some of the problems that I heard was like protocol and training and those kind of things, but overall, you're satisfied that the 911 committee as well is on board with this change?
Yes, all partners that I have talked to, I think there's advantages and disadvantages. We've explored it with all parties internally, as well as reviewed it with multiple other counties. Couple others that have a similar structure have all had positive reviews of it. And so that's what I'm recommending moving forward with.
Okay. All right. Does anybody else have any questions?
Megan or any of these guys? Jay? Nope. You're right. Okay. With that, then I would look for a motion to for this authorization of the reorganization of the 911 Communications Center in a position of clarifications. Okay, motion by Johnson. Here a second. Oh, second by Piaski. Any other discussion? Okay, bring them all in favor. Opposed? Okay, the resolution passes. With that, then, is there any future suggested agenda items? The one thing I would just like to ask or mention, next month, I will be I'll be gone on the date we have our meeting. So if we need a meeting, would it be acceptable to you guys to have a meeting a week later? Oh, I suppose. Okay, all right. So we'll plan on that. If we need to meet next month, it'll be a week later on that Wednesday. I don't know what the date is, but the week after we are normally meeting. So is there anything else that for future suggested agenda items? Okay, hearing none, I've looked for a motion to adjourn. Okay, second by Johnson. All right, we are adjourned. Thank you.